Welcome to Building Something Admirable, the podcast that takes you behind the scenes of how to start a healthcare-related business. I'll share each step that we took to establish our now thriving practice at Meyer Medical, including our highs and lows, insider advice, and real-life lessons in every episode.
Good evening, medical entrepreneurs. This is Alex. Thank you for tuning in. I'm in my wife's car, and the lighting choices at nighttime are not ideal, so bear with me on this one. But I thought we'd continue our discussion of finding your niche, and let's pick it up from there. Alrighty. So in the last talk, we landed on narrowing down your training specialty, which, depending on whatever you picked, still might leave you with a lot of choices. You know, I went through a physical medicine rehabilitation residency, and that narrows it down to, everything about it is wide from, spinal cord injury to sports medicine to pain management with back injections to brain injury medicine. So, really kind of broad choices there, and you don't necessarily have to narrow down a lot very early. Mainly because even if you think you have a perfect plan that fits with you, you're still gonna change your mind the minute you hit the rotations and see that whatever you thought was the case may not actually be the case in terms of what you like. And so it's really important to give yourself the opportunity to change your plan a little bit. So for me, I got through PM&R, and at first it took me a minute to figure out where I wanted to go with this, and actually applied to residencies thinking that brain injury was going to be the direction I went, at first at least. And the reason why was I found brain injury medicine quite interesting. And the pharmacology is very cool, very interesting medications that you work with, and the neuroscience, of course, is always stimulating. Anywho, so I got into residency, and even though I loved brain injury during med school, once I got to residency and was in the middle of my intern year, that's when I started to realize that there may be better use of my interests and better use of kind of my skill set, and also more marketable choices too. So, it's when you're looking at building a business and a career as I have now with Admire, certain specialties or subspecialties just inherently lend themselves better or worse for entrepreneurship. And you absolutely can turn anything into kind of your main setup with a side hustle, for lack of a better word. However, some obviously make it a lot easier than other ones. In this case, for me, it was not subspecializing in rehab, but having the broad experience and internal medicine internship gave me the background of medicine and the comfort with different non-PM&R areas of medicine that I started to dive deeper into other ways of applying this. Most folks, I don't speak for everyone, of course, in rehab, but many folks in PM&R don't like a lot of the internal medicine-y stuff. Internship is just something to get through so that you're a little bit better when you hit the years of residency. But I really did. And part of this I attribute to a few podcasts I was listening to throughout residency, including Peter Attia's podcast. Understanding, instead of just the immediate events leading up to a stroke, brain injury, whatever, I got really into the metabolic medicine side of things and understanding the decades of cumulative effect that went into the blood vessel disease that ultimately led to the stroke, or the substance use disorders that led to alcoholism and falling downstairs and brain injury, or X, Y, and Z from there. So for me, it made more sense for a broader training, or at least staying at a broader training, and then using whatever time I was kind of mentally preparing for fellowship to use basically just to build the practice or start working earlier and begin paying off loans and one more year of attending salary ahead of me to then be able to invest in something like this. Knowing my interest in metabolic medicine, though, and my prior experience as a personal trainer, and just kind of the concept of prehab, I quickly started looking into obesity medicine and understanding that most of prehab is a lot of metabolic and obesity medicine, or the flip side, working with folks with cachexia and frailty and things like that to help them build lean mass, in some cases in a hypermetabolic state. That dichotomy lends it to very interesting pharmacology again as well. On the frailty side of things, it's appetite stimulants, anabolic agents, even just kind of tweaking normal physiology with TRT, HRT. On the obesity medicine side, of course, it's all the old meds from when I started residency, and then as I was getting into residency, the GLP-1s started making headlines, and by the time I graduated, they were already in the market, and the rest is history. So at that point, it became clear that obesity medicine and prehab were going to be my thing. And my mistake, as I've touched on before, was going for the traditional routes of building the credibility and going for that any publications I could that would relate to it, which is a very, very good way of doing things to establish that credibility. And I don't regret it so much, but I regret not simultaneously taking everything I was writing and quickly turning it into content and basically different ways of educating others early on some of these concepts and chronicling my journey from then, instead of waiting until I graduated and already had almost a year of it behind me. Anyhow, so for you, dear listener, I think the next move would be, after you've narrowed down, so say you've narrowed down to internal medicine, or narrowed down to general surgery, or narrowed down to KM&R, if you really don't have an idea going into training, and while this does lean more towards MD/DO training, it still can be applicable to other practitioners, of course, too. But if you don't know exactly, and like truly know in your heart of hearts what is going to be your lifelong passion in medicine, then just pick something general. As long as you can tolerate it, it'd be much better to start general, get broad experience, and then drill into one area within that as you start to look around at the market and see the problems out there. So if you don't have a passion, but internal medicine seems pretty cool. I like knowing a little bit of everything. 3-year residency, nice. Not the easiest 3 years, by the way. Then as you're going through that, say you're on your internal medicine rotations and you are in an outpatient clinic rotation for endocrinology. Well, you could start a side hustle of putting together diabetic management for non-professionals. So for schlubs like me who just pretend to be a metabolic medicine doctor on the weekends, not true, but I'm just playing character here. Folks in that situation would likely happily invest in a little bit of a boot camp to get good at this. Or in my case, actually, one that I am going through right now, I'm kind of self-teaching TRT and HRT right now, and I've listened to many thorough podcasts and informal courses and everything. But if there were someone who that was all they focused on, and they deliberately designed courses for specific other specialties and how that area of management would apply to them, so you speak my language, that would be extremely valuable. And going into Alex Hormozy's sandbox here, what you want to be doing, of course, is drilling down to the most narrow niche in this case. Instead of just being TRT for medical professionals, teaching and building out courses for TRT for metabolic medicine professionals, TRT for sports medicine professionals. And in doing so, if I'm looking for a course like this and I see TRT for, physical medicine rehabilitation specialists, and in the quick summary, it clearly ties it to, we will teach you how to approach TRT for individuals with peripheral vascular disease who just had an amputation and some of the unique challenges you may face in this. I'm willing to pay 10 times as much as TRT in general, right? So find that kind of area for whatever you're interested in. So say instead you do family medicine and just really get into your sports medicine rotations, but don't actually do a fellowship in that. And instead you develop content about treating tendinopathies for dancers, or something that may not have a specific fellowship in this. And this is kind of where you may get more bang for your buck, is designing something like this, these educational materials, or just building your niche in something that is related to your field but does not have a fellowship available for it. So this way you're not going to be quote unquote outshined by someone with higher credentials in this area. You can become the expert just by publishing on it enough times and speaking about it, and really just being in this field for so long that in the event that they later do develop a fellowship for your specific area, or something broader that encompasses your area, you'll more or less be grandfathered in as still one of the experts in the field. At that point, of course, it wouldn't likely matter, because if you do have that audience, then it's irrelevant to you. You already have your market, you already have the expertise, you already have the name recognition and stuff, so it's unlikely you'd miss out. But in this way, if you get through your first couple of years of training or right out into practice, and you have something like this in mind, then you can very deliberately spend the remaining training years, or you could use your continuing medical education money that most departments give you and invest in the applicable courses, instead of just going to your specialties conference every year and going booth to booth and not really getting much specifically out of it for your field. One last final point, I have a buddy in residency who really gave his all for getting into space medicine. So he's another rehab physician and did rotations essentially at Tesla, and was able to get that specific experience. How many PM&R physicians can say that they are experts in space medicine, the unique challenges of the body in space? Probably one. Luke, thinking of you, bud. But really, if you can be in a market of one here, then no one can touch you. And by the time someone else gets the idea, you've already built your following. I don't know, whatever. They can come try. But at that point, it is more of you can be collaborators instead of competitors, because they can't actually touch whatever you've built. But that's the way to do this, to really think ahead and do your best not to waste any steps. If you want to go from wherever you are to wherever you want to go, you want to do it as short a path as possible to save you money, save you time, and let those benefits compound. These investments in content and studying and everything just compounds over time. So the sooner you do it, the more you get that benefit of the compounding benefit. I hope you found that helpful. Anywho, looking forward to talking about this more. Thank you for listening. Have a good night.
Stay tuned for more insider advice on building something admirable. Don't forget to like, share, and subscribe below.